Bismillah ar-Rahman ar-Rahim. I am Dr. Abo Omar, and this is meeting for orientation for Part B MRCS. Welcome everyone, and we will start first to know what are the agenda of our meeting tonight. We will discuss how is the process of exam booking and what are the factors that help you to book the exam. Can you see the screen?
No, I
Okay.
can't see the screen.
Yes, I will share it. Yes. Now? Hello? Okay, so this is our agenda for tonight's meeting. We will cover these points, and first one is exam booking. Exam booking, how is the process of booking exam, and what are the factors that help you to take this decision, which is very serious and critical decision, not easy to book like this. There are many factors affect your step for exam booking. Okay, we will discuss in details. Then what is the exam format and the structure of the exam, and what is the course content and schedules, and what we give you in our course. And of course, we will elaborate and show you demonstration of the new website. We have a new website now, not like the previous one. Very updated, and some advices, and then I will answer all your questions. So let's talk about, this is my name and my brief information about me. Then this is my result in Part B. I like to share it with you because Alhamdulillah, it was a great result in Part B, and I received email from the Royal College that this is a very great and high score. Okay, so this will be my knowledge, total knowledge, okay, and skills score. And Alhamdulillah, in knowledge section, I got very high score, Alhamdulillah. I got 149 and the maximum 160, okay? So in skills part, it's less, but Alhamdulillah, also it was very well result. This is my name, Asad Deghidi, okay? So in Part B course, it will not just a mentor. I will behave with you like a previous student. It's not just a mentor teaching only. No, I was in your situation before, and I know how to manage everything, inshallah. So the personal experience is very important, plus the teaching activity and teaching skills. Okay, so here we will talk about exam booking. Exam booking factors affect or control or help you to book the exam. Three factors, actually. One of them, study and preparation duration. How many months you need to study, okay? And how is your work, schedules, everything. So you will put this preparation time is a factor, okay? The average time from 3 to 5 months. Okay, the average for active study with the schedule, following plan and practice, everything from 3 to 5 months. Some exceptions, people make it less than 3 months. I have some students like this, and some people require more time. Okay, this is for average student, 3 to 5 months study preparation with regular daily basis preparation and practice. Okay, which Royal College? Here in Part B, it's not easy like Part A, actually, because in Part A, all over the world, we have a 3 times exam, only 3 times a year in the same day as you see. But in Part B, we have 4 Royal Colleges. Every Royal College has different centers, and each center has different time of exam. Can you see? So the centers not available in all countries. There is only there are specific centers only to sit the exam, because it's OSCE exam, not online like Part A. So you need to know which Royal College and which center. According to what? Regarding the Royal College, I will show you now. Hello? Okay, I will show now all dates of exam within 2026. You know, this take a very big effort to prepare this file. From the 4 Royal Colleges, I collect all of them here. So, for example, Royal College of England. Can you see the screen, right? Royal College of England. Within 2026, there are all these centers. So there is in Pakistan, in Sheffield, London, Glasgow, India, Mumbai, Egypt, Abu Dhabi, Malaysia, India again. And each exam, I put the exam date. So the duration of preparation, you will check from here. So there is exam in April. I don't recommend anyone to sit in April because now we are in March. So skip the first one. So there is exam in May. Okay, some people I recommend it for them because if they are working very well and they are active learner and active study, so they can sit in May. I recommend May for people who need to finish early. But the problem in May is that this exam in UK, Sheffield, London, and Glasgow. So international students maybe find difficulty to get UK visa because we are dealing with all nationalities, our students from different countries. So the other factors of which center here will make your decision because not everyone can easily travel to UK. I have many students before when they apply for UK exam and they fail to get the visa and they cancel the exam or postpone it. So you will put in your mind if your country has a center or no. This is one thing. For example, in Bahrain, there is center. In Saudi Arabia, there is no center. I have to travel to another country. In Egypt, there is center. In all Africa, the only center in Egypt. So one continent, only one center in Egypt. But in Asia, there is Bahrain, Abu Dhabi, Oman, Malaysia, India, Pakistan, many centers. In Europe, there is England, as you know, UK. So you will think about what? You will think about if your country there is center or no. If there is no center in your country, you need to think which country easy to travel to get the visa. This one question you have to think about, okay? And you must select the country that you can easily get the visa for this country, okay? Because as I told you, many times people fail to get the visa for different countries and they cancel the exam. After they make a great effort in preparation, in the last 2 weeks, they fail to get the visa. If your country has a center, this is good. But still, if your country has a center, but the exam in your country, in the center of your country, for example, after 8 months, and you don't like to wait, some people need to finish early, so you can think for another country. You know, it's not easy. I mean, you have 3 factors. So if your country has a center, but the exam after 1 month, it's impossible to set it. You got my point? So you need to make this 3 factors in your mind. Which exam, which center, which Royal College, if your country has a center or no, and the duration of preparation. Anyway, if still anyone confused, we can make it as individual discussion with some of you. If you still lost, okay? So I collect all Royal College exams within 2026, okay? So here's the Royal College of England, starting from April, May, June, July, September, October, November, December. Ireland as well. We have there are 4 exams within 2026 in Malaysia, Egypt, Dublin, and Bahrain in November, then Glasgow and Edinburgh. Then I make again the list of all dates, but date-based. Date-based mean according to the time or the duration for preparation. For example, I canceled April, so I start from May. In May, if you like to sit in May, here the main factor for you will be the duration. If you are ready to sit for May, then you have these Royal College and these centers. Okay, if you need to sit in June, there is only one exam in India. Okay, so this will be good for Indian friends. If you need to sit in July, okay, again, it will be this Royal College and this center. So for England, Royal College of England, there is exam in Abu Dhabi in July and another exam in Cairo in July as well. Okay, if you need to Glasgow Royal College, then Egypt and Abu Dhabi again. Edinburgh, there is in India. In August, again, and so on. You see, all until December. All these exams by month, by date. And this also dates by Royal College. Okay, so let's go again for the exam booking. Exam booking process is a bit confusing, but again, you need to know if your country has a center or no, if the time in this center enough, or you need to wait, or you need to go another country, and then the Royal College. The Royal College, you can make account in any Royal College. You can change the first part Royal College. If you sit in part A in England, you can change to another Royal College. Very easy and no any difference. No any difference. Okay? So I make my part A in England and my part B in Ireland. Okay, so it's not make any difference at all. Okay, whether exam difficulty, whether results, whatever the value, it's all the same. Okay, so we discussed now exam booking. Any confusion here? Again, you can call me directly in Telegram to ask me about any confusion, and also you can contact the admin. The admin has these files and can help you how to select. Okay, the exam fees as you see. Then again, another advice in exam booking. When we say that the exam for example in Bahrain will open in this date, this means you must book it as soon as possible. Why? Because again, it's not like part A. Opening and the closing date are fixed. No, opening and the closing dates are estimated dates. I mean, when it opened, it may close in the same day. It happens many times. Open and close in the same day because they have maximum number of students. They can't accept everyone. So again, remember this advice, the number of any exam is limited according to the maximum capacity of the center. So it's based on the first booking, then they will have the priority. Okay, so don't think about the exam the closing date. So when I put here closing date, for example, 19 March, don't wait. You know, you must book as soon as possible. If you select this exam, don't wait. Again, because we find many students after they try before the closing date, they found it's already the exam already closed. Okay, so this date not sure. Once the capacity of the center completed, they will close the booking. Okay, so these are the advices regarding exam booking. So we discussed everything about exam booking, and this is the website of all Royal Colleges. Also, if you need, we can share with you. So you directly to go for Part B booking, okay? With this link, England, Glasgow, Edinburgh, and Ireland. Just ask the admin to share the link with you to be active link, and then you can book directly Part B. Okay, according to the center in your country or another country, according to the time, the date of exam, is it okay for you 3 months or you need more, and according to also the which Royal College. Okay, then now we will talk about the exam format. How is the exam? Again, this exam is OSCE exam. It's not written, it's not MCQ. So it's mainly depend in verbal communication with the examiner, with the patient or actors, and so on. So the exam mainly have two big sections: knowledge section and skills section. Knowledge including 3 branches: anatomy, pathology, and critical care. Anatomy as information similar to part A, but the way of questions different. Okay, so I will show you example for every branch. Don't worry, but just know that we have knowledge section. Here there is no patient, mostly there is no patient, but skill section you will do something with your hands, some skills, not only knowledge as a study and theoretical study. So knowledge include anatomy, pathology, critical care. Skills include history taking skill, communication skills, and the clinical examination and procedure skills. Okay, so how many stations of each part? Knowledge, including this anatomy, 3 station anatomy, pathology, 2 stations, critical care, 2 stations. Okay, sorry, critical care, 3 stations. So total 8 in knowledge. Total 8. Anatomy 3, pathology 2, critical care 3. And in the skills section, everything is 2, but clinical examination 3. So communication 2, history 2, and procedure skills 2, and examination 3 stations. Okay. We have some other stations like this, but it's not for questions. So for example, we have 2 rest stations. What happens in the rest station? You will sit only without any station, without any patient, without any questions, just to sit and relax if you need to have some coffee or any snacks. So this 10-minute break like that. And they will be randomly between the rotation. In the start of exam, everyone will stand in front of one partition or one room, okay, to start. 20 candidates will be distributed over 20 partitions or rooms. And you will stand outside like this, and every 10 minutes there will be shift. Maybe your luck, you will start with the rest station. This is actually bad luck. Okay, because you just come and you will start with what? With the rest station. Okay, but anyway, this is your luck. We can't expect that. So the 20 students will be distributed over the 20 rooms, and every room has a station. Maybe this station anatomy, pathology, or critical care, or history, whatever. You don't know. After that, you will enter inside the room, start your exam with this station. After this, there is a bill, they will ring the bell and you will shift to a next station and so on. So everyone will rotate over the 20 rooms, okay? But as I told you, there are 2 stations just for rest and relax if you need to eat something or drink or just rest your mind. And another preparatory stations. These preparatory stations also no exam here, but you just sit in a room with the patient file to prepare yourself for the communication station. What is this? Before the communication station, you need to prepare. You need to know what is the topic of communication. You can't communicate directly, randomly like this. So you need to sit in a room, and in this room, they will give you the file of the patient. Okay, so in one communication station, you will communicate with the patient or the relative of the patient. So they will give you some data, and you need to talk with him about the topic or the case, whether the operation postponed or any problem like this. Anyway, you need to read the file very well. Then you will be ready for communication, whether with the patient himself directly or mother or wife of the patient and so on. Okay? And another station, you will communicate with your colleague in another department, ICU registrar, your consultant, whatever. So you will communicate with a doctor, not a patient or relative. And here also, you need to prepare the file, you need to read it, prepare yourself for the communication to update the consultant about the case. You will tell him the case has hemoglobin like that and receives IV fluid like that, and the INR is like that. So he will ask you why you will not give him warfarin, why you will give warfarin, and so on. Okay, so you need to take, and he will ask you about everything. So you need to know what is the important relative data in the file to keep in your mind. In this station, you have paper. You can write some notes, important notes you can write them in paper to be ready for the communication with the consultant. Okay, so these preparatory stations, 2 stations, it's not station, it's just, we can say also break or pre-station, before communication stations. So there is no questions here, just you will prepare yourself for the communication stations. Okay, this is the structure of the exam. Okay, so regarding anatomy, how is anatomy? Anatomy in part B is very easy, but require a special skill. What is this special skill? Your visual memory. This is the trick. Visual memory. You need to, and this is a very high skill in females, more than male. Okay, but anyway, with practice, you can be perfect in this one. So what is the visual memory? Because the first station the first question in any anatomy station is identify. Okay, identify these numbers. For example, they will show you one picture like this, or a real bone or a model, and ask you identify number 3, identify number 10, and so on. So then they will ask you some questions. Okay, like this, and you will answer. We have all updated questions in anatomy, alhamdulillah, all updated questions in the recent exam, and in most centers, we already collected and prepared for you. Okay, so this is the example of anatomy station. They will ask you identify these muscles, and sometimes he will ask you what is the insertion, what is the nerve supply, what is the origin of the muscle, what is the action of the muscle, like that. Okay, so this will be the anatomy and anatomy. So in pathology station, they will give you a brief STEM scenario about the patient, some positive information, and ask you some questions. Okay, here there is no patient. Okay, and in critical care, ASCC, critical care station, the same. But in critical care, it's different. It's like physiology, if you remember physiology, and some very operative information and the critical cases. So it's called critical care. Here you will study the critical care. You need to prepare some information about investigation interpretation. So they will show you ECG, they will show you CT or MRI, and you need to diagnose from this. And all this, don't worry, all this with us. That will come in exam, inshallah. Okay, so there are some questions like this, whether you will identify something in the ECG or X-ray, or they will ask you some questions about how to manage a critically ill patient. There is patient after trauma or after major surgery, and the patient deteriorate, and the patient situation is very critical, how to manage and how to deal with him. All this will be discussed in the lectures and in the practice with us, inshallah. Okay, so in critical care, we have a special point. In critical care, 20 mark of the station, they make 4 marks for professionalism. Okay, and this is also very important point. What is the professionalism? When you answer, I have, when we make the revision with our students, we can find 2 students say the same answer. Word by word, same answer. But I will give this one full mark, and I will not give this one the full mark. Why? And both of them believe they make the full answer, and they need to take the full mark. But I will not give the full mark for everyone. Why? Because you need to act in front of the examiner that you are professional. You don't just memorize blindly. You are not a parrot. You know the answer from your practice, not just reading it from a book and memorizing it without any confidence, without any practice for this information. Okay? So when I ask you simply how to make tea, you will talk very confidently, and you will explain how to make tea or coffee very easy because you already make it daily, right? But if you read how to drive a train, you read it. When I ask you, you didn't drive a train anymore, anytime. When you answer this question, I will feel that you are not doing it any time in your life. I will feel this, okay? Because your way of answer is not confident, not easy. I feel you are not professional. You just memorize this. You got this example of how to make coffee and how to drive a train? This is exactly what will happen in exam. When you answer, you need to act. I know you didn't make this, but you need to act. Behave like this is your daily action. You can do it easily. This is you make this procedure or this management every day in your hospital. You got the difference? And this is not easy to behave like this and to act like this, okay? So the professionalism marks can be lost if you just show the examiner that you need just a record. You need to only throw your answer because you memorize it and you are worried to forget it. Okay, Soma, you got it? Hello?
Yes, it's clear. Thank you.
Everyone got this point, please, because the professionalism is very important. And this is main cause of people fail the exam and got low score and so on. Okay, professionalism, alhamdulillah, it was my first skill, alhamdulillah. So even because I am ENT, I'm not general surgeon. So many procedures I didn't make in my practice. But when I sit the exam, the examiner was happy with my answer and I was confident. Alhamdulillah, this is very important skill to get very high score. Okay? Then in communication, as I told you, we have 2 types of communication. Communication with patient or relative, like this patient need to discharge against medical advice, or anxious mother, or angry patient, angry wife, whatever. All this will be discussed. And again, there is a phone call with consultant or another doctor, like patient with oligoria, patient with complications, and so on. Okay, this is the phone call communication with another consultant or another doctor in another department or ICU. Okay, so here booking a post-operative bed in ICU and so on. History taking, also 2 stations, and it will be covered many topics like GIT, urinary system, respiratory, musculoskeletal, and so on. So you will take history from the patient himself. Actually, he is actor, but you will make the steps of history taking with the actor. Okay, clinical examination. Here, there is actor or patient. rarely real patient, but mostly actor, and you will find the stem outside. The patient has, for example, knee pain and so on, and then examine his knee. So you will make knee examination, hip examination. So all types of examination here will be discussed, okay? Everything vascular, orthopedic, but you must face one orthopedic station with another two. So 3 examination, one of them must be orthopedic. Okay, and another 2 maybe vascular, maybe neuro, and so on. Okay, procedure skills here also. You will do some procedures, only 2 stations, maybe abscess drainage and suture of the wound, excision of the nevus, fine needle aspiration, and so on. All this will be discussed also. 2 stations. I think this one will be very easy for you as a surgeon, and also clinical examination for some people will be easy, especially orthopedic people, and history taking. As if you work in UK, history taking and the communication will be very easy for you. Okay, this is the structure of the exam. Then what will be in our course? Okay, in our course, as you know, it has again 2 parts. Basic part, which is valid for 1 year. Okay, because maybe you don't book the exam, but you need to start early preparation. So you can start from today, tomorrow, your preparation, soft preparation. And when you decide to book the exam, you will inform us, then you will start your round. We have 4 rounds. Okay, but the basic course is valid access for 12 months, and there is hard copy of the books you will request, but it will be with extra fees because we will ship it to your address. Again, the basic course include recorded lectures and also include teaching videos. I will show you everything in the application now, okay? Because I share now the screen, but then I will show you everything in the website itself. Okay, we have also a very big library and store of teaching videos. In everything, we have a very big store of teaching videos. This is not found in any other course. And another gift in our course is Atlas, Anatomy Atlas. Okay, what is the idea of Anatomy Atlas? When you start study from anatomy book, you will find the pictures and I will try to show you. For example, let's take upper limb anatomy. I will show you how is the atlas is important, okay? But give me. Yes, for example, this is our anatomy book, and you will study. Okay, you see this picture? For example, everything is written, okay? Again, all details written like this. So what is the idea of anatomy atlas? In anatomy atlas, you will find the okay, let's show the atlas. This is Abo Omar Anatomy Atlas. You will go for it, and for example, we will. Okay, for example, upper limb. What happened here in the atlas? The idea of the atlas is I remove all details. So this for practice of identification. So here the picture without any details, only numbers, and you will practice what is number 1, 2, like this, and then you will click here, all details will come to you. Okay, and so on. This is just the picture that we saw in the upper limb anatomy in the book. Okay, here there is no details, all details deleted and numbers put like this to test yourself. Okay, so again, you will click answer and you will find the details. So, and so on. This is the Abo Omar Atlas that I told you. Okay, so Atlas is very important for practice of identification. And we have one big Atlas in the basic course and one big Atlas again in the revision course. The basic course just for practice during the basic course. And when you join the revision course, you will find real exam pictures. The most recent and updated pictures of real exam. So I will show you also there. Then here also in the basic course, you have question banks. Also in training section, you can find question banks. So what is important and most specific in our course, the teaching videos and the Abo Omar Atlas. In the revision course, it will start about 40 days before your exam. It's only about 40 days duration. Then we make it 4 times a year. So from the 1st of January till February 10, and from April 1 till May 10, and so on. So 40 days, starting from 1st of January, 1st of April, July, and October. Okay, and also all meetings will be recorded and available. And again, here we have another atlas in the revision course. And in the practice, you remember the course of part A? Here we call it MOOCs. So we have two types of MOOCs. Topic-wise MOOCs. Topic-wise means we have upper limb MOOCs, lower limb MOOC, and so on. And mega MOOC. Mega MOOC means in the mega MOOC, we will sit with the student, okay, in a meeting and ask him in all topics, random stations like real exam. Okay, so we call it mega MOOC. For example, the student will be asked in one anatomy station, one pathology, one critical care, one clinical examination. Okay, this will be at the end. Okay, I will show you the schedule now. So topic-wise MOOCs in the start, we will start, you will follow the schedule, upper limb MOOC, lower limb MOOC, and so on, pathology MOOCs, and so on. Then we will go for the mega MOOC, and all MOOCs, this is the recall of part B, recent and updated from the recent exams. Okay, what are the rounds of part B? We have 4 rounds, as I told you, and we now in the round 1. Round 1 started already. So what is round 1? First of all, before select the round, you need to know when your exam. When is your exam? If your exam in May or June or early July, in the first 10 days of July, you can join round 1. So in the round 1, you will start basic course, active study, not just joining. Joining, you can join at any time, but you must follow the schedule of round 1. When you join in January 1st, then we have open discussions, and also revision course will start April 1st. So people sitting in May or June, they can join now, and we will start the revision in April 1st till May 10. Okay, so this is the best round for people who will sit in May or June or early July. If you will sit late July and August, September, you can join round 2. Okay, and so on. The details again, write like this, and we can help you to select which round. But the first question before select the round, you need to tell when is your exam or expected time of exam. Okay, just tell I will sit in May, I will sit in September, then we will help you which round will be good for you. But this doesn't mean you will wait until this. No, you can join from now. The round means the active cycle. Okay, but before you join the round, you have the access for the basic course and you start study. Don't wait. Okay, don't wait, because you need to take longer preparation. You can start early. But once you decide your exam, join the suitable round and we will follow you in the cycle, in the round cycle like this. So these are the 4 rounds in the, hello? Okay, these are the 4 rounds of part B. Okay, and again, we will help you how to select your round. If the exam not booked yet, so you will continue in the basic course, but your maximum validity for 1 year. And here you will make self-study, but we can follow you. If you have a question, you can ask, and it's like this. But the active cycle will start after you book the exam, or at least decide a date of exam. Then you will continue also in the basic course, but you will join the suitable round according to the exam date. And here we will start the active cycle. Active cycle means we will share a schedule with you like this. For example, this is the schedule of round 1. Round 1, 2026, starting January 1st for the basic course preparation. Okay, this one. And then the revision course starting April 1st, the next April. Okay, at the start of this April. So here, this is the schedule for the revision course. We will start practice and the revision and the MOOCs for everything. As you see, history MOOC 1, MOOC 2, MOOC 3, upper limb, like this. This is the topic wise, and then the mega MOOCs, 11 mega MOOCs. Okay, in the end of the revision course. Okay, so I will show again the application. As I told you, this is the atlas, all parts of anatomy in the basic course like this. And also we have a training section to practice. Practice what? If you don't have a study partner and you need to practice with yourself, this website can replace the study partner actually. But Still, the study partner important, but if you don't have or the time is not fine to find a study partner, so you can practice with yourself as a study partner. With the same idea of the atlas, we make all curriculum in this way. For example, let's start this station, okay? So what you will find the question, okay, polytrauma with liver tears. This is the name of the station. Start, then here, management according to ATL protocol, comment on this X-ray. So this is the question. You will see the X-ray and you will answer. Then you will click the answer, okay? So here you will practice, but in the book, the question and directly the answer behind it, follow it. So you don't have a chance to test yourself. In the book, as I told you, the question and the answer together. I will show you the critical care book, for example, critical care book. This is a sample of the critical care book. So 1 second, this PDF opening. Yes, this is the critical care, our book. So here, as you see, the question, the answer, question and answer. If you study and memorize everything, how to test yourself, you have two options. Whether you have a study partner asking you and you don't open the book and answer him, this is good. If you don't have, then you have this option in the website. So the question and the answer. How to answer the question? You have two options again. You can answer it loudly or you can record your answer. After that, you check your answer if it's correct or no. Okay, and so on. So if you are alone, you can study with this, practice by this way. Okay, so all stations of the critical care and the pathology and everything put in the training section like this. Okay, so you can practice by training section. In videos, you will find all videos. I will show you now. Lectures, again, teaching videos, very big library of teaching videos, and open discussion meetings and orientation meeting I will upload tonight, and some important short videos like this from part A, but help you in part B, like subclavian steel, RAS system, some renal physiology, and the smashed EBG. And in teaching videos, here you will find teaching videos in procedure skills, clinical examination, anatomy, some sample station, and so on. Okay, this is the teaching video, and here all lectures like this. Okay, so these are the contents of the basic course. Let's go for the revision course. In the revision course, we have something called pre-MOOC course. What is the pre-MOOC course? This is a full recorded revision course. So in it, you will find, again, videos, revision course, and all MOOCs recorded already. Okay, critical care MOOCs, pathology MOOCs, anatomy, history, skills like this, and even mega MOOCs recorded. Why recorded? Because before start your active practice, you need to watch the previous record, and then you can sit with me in the active session and to avoid the mistakes of previous students from the record. After you watch the record, you will learn how I correct all mistakes of any student. From this, you will learn how to avoid these mistakes. When you come to me in your live session, then you can test yourself as a knowledge and as a common mistakes repeated before. So you can make the maximum performance and the best performance with me. Okay, in the revision course also, you will find training, and in training, again, you will find the Abo Omar Atlas, okay? Revision Atlas. In the revision Atlas, you see this. In the revision atlas, you will find the most recent pictures, okay, for exam, okay. So you will find all recent updated pictures. It will upload, but anyway, it will be available in maybe not activated yet in the website. We will activate tonight, okay. So because there is no revision course now, we close it. The revision course, as I told you, will start in April. And in the Abo Omar Revision Atlas, all recent updated pictures from recent exam updated here. Not the same like the basic course. Okay, so now we discussed everything about general sample books. Already I show you some advices, like you need to find a study partner to study together, because if you are two person only, you can find a suitable time for yourself to practice together. And this exam, not written exam, you need to practice, you need to speak and loudly talk with someone, whether with me in the meeting, whether with yourself, and record your answers, and or with a study partner. when we announce about in life practice, try to do maximum best to join. Not like part A. Part A, some people can take the benefit from the record only, and it's okay. But here, it's not like this. You need to practice. Don't only join passively and listen to other people. You need to talk and assess yourself and correct your mistake. And also, professionalism is very important in skills and in the critical care. Okay, I think I finished all what I like to talk about now. And so if someone has any question regarding anything, please ask. Hello? Hello? Any question in this demonstration, in this lecture? Hello? Suma, Muhammad, Jonah, Ali?
I have a question, but it's not regarding the course. I mean, it's I want to know the price. How much do you charge for it?
We for the course we have offers actually. The admin will tell you because we make offer for the first 5 participants who will join. Okay. After that, it will be with the same price like before. But generally, the price for our people who will join part A will be less than other people. Okay. So for generally for our part A candidates, they will take less than others, and for the first 5 participants, it will be more discount. Okay, but the first price was 360, like part A, 360 for the first price. But for our part A candidates, it will be less, and for the 5 participant, the first 5 participant or who will join, it will be more discount. Okay, this is regarding the course. For the exam, I shared. I think it was written here. 1 second. You ask about the exam fees, yeah, Soma, or course?
No, the course fees.
Okay. Okay. Anyone else has any question? Hello, Virgil, Trevor, Ahmed, Richard.
No questions. Thank you.
Okay, I hope everything is clear. But again, if you need help in how to book the exam, or how to select the round, you can contact us individually in a call, in Telegram, or with the admin, and we will help you to make this very easy, inshallah. Okay, thank you so much, and goodbye and good luck. Assalamu alaikum.
Thank you. Bye.
Welcome, John. Bye.
Thank you. Bye.